Hi everybody, it's Dr. Samantha Smith. I am a home health physical therapist that specializes in knee replacements. And today in my Facebook group, I got a really great question from one of our members about questions to ask your surgeon before you have surgery, kind of interviewing your surgeon, what should you be asking them. So if you're not in my Facebook group, please join. You can search it in Facebook by searching Succeed with Your New Knee at the top of Facebook, like in the search bar, or I'm going to link it in the description below and you can click and join the Facebook group. So this is a really great topic because you need to know what your surgeon is going to do so you can tell your physical therapist so they know how to prescribe exercises, and it's just great to know everything that the knee replacement entails. So I do have a document over to me on this side that I'm going to be reading off of. I've made a list of questions and you can also access that in my Facebook group. It's available to screenshot or download or whatever you want to do. And then also this list of questions will be covered thoroughly in my knee replacement course, which will be out February 2023. So if you're watching this after February 2023, go check out my website, succeedcourses.com, and you can find my knee replacement course. And all of these questions will be covered in detail. So I'm going to cover them just briefly in this video. So first question, can I get my pain medication ahead of time? This is really important to ask your surgeon. The last thing you want to do is be stuck without your pain medications because you sent them to the wrong pharmacy or something weird like that happens every once in a while. What happens if I run out of pain meds or I don't tolerate them well? Your surgeon should switch your pain medication. If you can't handle hydrocodone, oxycodone, they should switch you to something different. Will I get an ice machine sent home with me? This question totally depends on the surgeon. Some surgeons do maybe have like some sort of contract with the ice machine companies. I'm not exactly sure how that works. You can look around and see if you can rent them. A lot of my patients will just go out and buy them on Amazon. They're about $250. You can borrow them from friends. I would definitely recommend the ice machine. Will I get a CPM machine sent home with me? So this is kind of an outdated machine. Not many surgeons use it anymore because the research shows that it's not useful. And but some surgeons use it. It's totally up to them. So just ask your surgeon if you'll be sent home with one. Will I have home health or will I go straight to outpatient? So if you're younger, your balance is pretty good, you'll probably go to outpatient right away. If you're older, you have mobility issues, maybe you don't have somebody to drive you, you'll have home health. What exercises should I do for prehab? So your surgeon might not know exactly what to give you for an exercise routine. That is the physical therapist's job. So exercises you need to focus on. You definitely need to strengthen the quadriceps and stretch the knee. I will cover that fully in my knee replacement course. There is a huge section on prehab for different levels of mobility. How do I know if my PT is experienced? So this is a question you just ask your PT. How many years have you been a PT? How many knee replacements have you seen? You want to know they know what they're doing. How many surgeries do you perform per year? So you want a surgeon that focuses only on knee replacement because they are experienced in knees. What is your patient satisfaction rate 1 year post-surgery? You want a surgeon who can say 80% of people are satisfied and the other 20% have mobility issues. How many of your patients need a manipulation under anesthesia? If you haven't seen my video about manipulations under anesthesia, I will link it below. But you want the surgeon to say not many. Generally, manipulations under anesthesia should be done between 1% and 3% of the patients. How many revisions do you do per year? So a revision is what happens when you have a knee replacement and then you get another one. So you already had one and then they're fixing that one to give you another one. So that's not a good thing. You don't want to go through two knee replacements. The revisions really tell us how good the surgical technique is. So if your surgeon isn't doing many revisions, that is a good sign that they're a good surgeon. What do I do if I have an urgent question? So great question. A lot of times surgeons' offices don't answer the phone. So before your surgery, call them and see if they answer the phone. Are you doing cement or cementless? 90% of knee replacements are cemented. The other 10% are cementless. This is done in younger people with good bone growth. Are you replacing the underside of the kneecap? So 90% of knee replacements replace the underside of the kneecap because generally is arthritic, has bone spurs on it, etc. Will I receive staples, nylon sutures, or steri strips? This totally depends on the surgeon. It doesn't matter. Are you using quad sparing techniques, or will it be a traditional incision? Again, about 90% of surgeons use the traditional incision. It is highly researched. It is very successful. Which ligaments will be removed? So generally your ACL and your PCL will be removed. They keep the ones on the outside called the MCL and the ACL. Will I be tested for metal or cement allergies? Most of the time they do not test you. If you are a person who is highly allergic to things, like you're allergic to everything, ask them to test you for metal allergies. Do you use robotic assistance during surgery? So I've only seen like 1 or 2% of my patients having a surgeon that does robotic assistance because it's not very common. A lot of surgeons aren't trained in it quite yet. So it totally depends if your surgeon is trained in robotic assistance. If it were me getting a knee replacement, I would want my surgeon to use the robotic assistance because less bone is cut. It's more precise with the measuring, but the surgeon has to be experienced in doing this because the biggest thing with a knee replacement is the implant has to be in there correctly. If it's not in there correctly, then you're going to have poor outcomes. Another question, do you use a tourniquet? Again, about 90% of surgeons will use a tourniquet. That is just a tourniquet around the upper thigh to control blood loss. So these are the questions that I've come up with to ask your surgeon in the interview process. This will give you an idea of what to expect after surgery. And if you have symptoms, you know, if, for instance, if you have upper thigh pain, you'll know, oh, okay, well, I had the tourniquet on. That's what the surgeon told me. So maybe my thigh pain is from the tourniquet. So things like that, it's important to know kind of the details of your knee replacement. And again, all of these questions are covered thoroughly in my knee replacement course. So I'm hoping to get that out as soon as possible, but thank you guys for watching. See you again next time.